So I'm absolutely delighted to welcome Deborah Ashby to our local group meeting. So Deborah is the current president of the Royal Statistical Society, and as he's going to run through a variation of the presidential address slides, which has the quite an intriguing title, I think. Florence Nightingale, Pigeonholes and Mustard Seeds, using data to improve health from the time of the Crimea to the time of the coronavirus. And as many of us are work in the health sphere, we're very much looking forward to hearing this. So just as a reminder again, if people want to raise questions during the talk, please do that by sort of raising your hand and typing in a comment, and we'll do our best to cover those questions at the end. But for now, I think I'm going to simply hand over to Deborah.
Right. Well, I shall attempt to share my slides in just a moment. But firstly, I want to say thank you for the invitation to Leeds. When I accepted, I had no idea it was going to be taking this kind of format. I hope the weather up there is something like as wonderful as it is down in London. So this is something of an experiment for me. I'm meeting all sorts of new platforms, and this is not one I've used before, so bear with me. Wonderful. So, as you've just heard, I want to talk a bit about some of the themes that I talked about in my presidential address in June last year. But when I was going over it, I thought, oh, I've got some new things to say. So that makes it certainly less boring for me, but hopefully slightly more relevant for you as well. And I knew when I presented my presidential address last year that it was going to be Florence Nightingale's 200th anniversary this year. And indeed, we celebrated her 200th birthday just last week. So we've got more of a focus on Florence Nightingale. I'm going to start with just her brief demographics. And this is a copy of the entry of her birth certificate. Well, it wasn't even a birth certificate because it was in 1820, which was before the current system kicked in. But she was actually born in Florence, which is why she was named Florence. And I think it seems this registration was actually taking place in London, so presumably it was when her parents returned. This is her family tree, and I'm moving my arrow. I hope you can see that. So here's Florence down here with her sister Parthenope that we'll meet briefly in a minute. If her father had followed convention, her surname would have been Shaw, because that was his surname. But actually, in order to inherit a legacy from this branch of the family, he very wisely changed his name to Nightingale. So I think Florence Nightingale has got quite a lot to be grateful for. The other thing I just want to highlight here, because it's relevant, is that Florence's mother, Frances, was the daughter of someone called William Smith. Just as a by the by, her aunt had married presumably her brother, so we seem to have two brothers and two sisters getting married here. But William Smith was an MP of long standing, and I think that partly explains some of the things we're going to go and look at in Florence's life. She lived 90 years. By the time she died, this is a much more conventional birth certificate for anybody that's a death certificate for anybody that's done any family history or had other reason to get these certificates. And I think, to me, that's just an indication of how far the world had changed. But let's roll back a bit. Florence had a conventional upbringing for a sort of middle-class family. Her father was Cambridge educated. But what was slightly less conventional was that as a woman, she wouldn't necessarily have got a good education, but her father homeschooled her. And he homeschooled her with her sister. That's Florence in the pink dress sitting down, her sister in the mustardy coloured one standing up. And it was quite a wide-ranging curriculum, Latin, Greek, history, philosophy, mathematics, modern languages and music. I'm very used to saying when I give talks, oh, Florence studied mathematics, but actually the range really hit me when I was preparing for this talk. Her sister preferred sketching, and I think that's a sketchbook she's got in that picture, whereas Florence's Greek was actually good enough to help somebody called Benjamin Jowett translate Plato's dialogues later on. So she was clearly a very well-educated, very able woman. She had an interesting young adulthood. I mean, a lot of people, when they get to university kind of age, think about what they want to do. And at 17, she had a mystical experience, and she was 17 in that previous picture. She had a calling that she was not destined for a conventional life, and she was deeply religious, and that is at the, although I'm not going to talk very much about it, that's at the, I think was the absolute rudder of what she was doing. She was interested in nursing, and she wanted to go to Salisbury Infirmary. And as she said, it was as if I wanted to be a kitchen maid. It was looked down on. Her parents did not think that was suitable for her to go and do. And she basically drew the conclusion that only widowhood or poverty would allow an educated woman to go to work. But what she did in 1848, which again had a profound influence on her, was to go to teach at a ragged school. These were popping up. The one in Westminster is the one that I've got a picture of to the right. And that opened her eyes to poverty, and again, I think influenced a lot of her life's work. But her family, again, were not keen, and they are not socially distancing in that picture. And I'm sure that would have been partly what her parents would have been worried about. So again, this is a whistle-stop tour through some of what had an influence on her. Having been thwarted in those ambitions, she went off on a cultural tour of Egypt and Greece. But she visited a hospital, which was also an orphanage and a school near Dusseldorf. And it was owned by a pastor or run by a pastor and his wife, but had staffed by deaconesses, in other words, women. And she was very taken with this idea. She returned, and she went and trained as a nurse at Kaiserswerth. Her family were livid, but by this time she was kind of not necessarily doing as she was told. But when she came back to the UK, she couldn't find an outlet for that training. So she then sort of went on a tour. There must have been a lot of money lurking around, but she went visiting hospitals through UK and Europe. And she started collecting information. So this is the statistician that started to come out, reflecting on hospital reports and on government publications on public health. But eventually they found her a suitable job. Harley Street is where the private medicine still is these days. And she became lady superintendent of an institution for sick gentlewomen, which I presume her parents thought was okay. And she obviously didn't want to stay too long there. And when the Crimean War started, this was her opportunity, and she was off. And that's when she got the Lady of the Lamp. But I think just looking at the background against which she did that is quite illuminating. These, for anybody who knows anything about Florence other than the fact she was a nurse, are well known. These are her analyses during the Crimea of mortality, looking at what are the causes we expect that soldiers might die from, in other words, wounds, which are the black bits, and then looking at what were the other kinds of deaths going on, which absolutely dominated. And I can't help but draw comparisons between these and what we're trying to do with coronavirus at the moment, of looking at what are the deaths from coronavirus, what are the deaths which are made worse by that, and which are the ones which, if you like, are collateral damage, the undiagnosed cancers, the untreated strokes, and things like overdoses, psychiatric problems, all of which are sort of collateral damage, if you like, of the coronavirus, and not unlike the analysis she was doing there, except her analysis was a lot more accurate than some of the ones we're presented with. In analysing this data, she became friendly with William Farr, who's the bearded gentleman, and he's the one who's responsible for having sorted out the birth and death registration system onto a proper footing. William Guy is the other cheerful chappie we've got there, and they and a few others were her sponsors when she joined the Royal Sister Society. She was the 796th member, and as far as we know, she was the first female. So that's something to be very proud of. But she had another characteristic, which was that though she'd been very keen on education and really quite a classical mathematical education when she was younger, she stopped being interested in for knowledge's sake. She started focusing much more on what's the purpose of it, what's the action. And I was interested that she inspired supporters to set up the Nightingale Fund for Reform of Civil Hospitals by establishing an institute for training of nurses and hospital attenders. So you can see where the influence of Kaiserworth is coming in. I gather once she set it up, she rather left them to run it. She didn't get involved in the nitty-gritty. She went on to other things. But nevertheless, she was the one who sort of got them started. And not content with having taken her lamp around in the Crimea, she then came back and campaigned for a full commission of inquiry into Crimean deaths. In other words, why, when there were only 4,000 deaths from battle is still serious enough, but why, when that number was 4,000, were there 16,000 from disease? And I could quite see that if she were living today, she would already be raising, as many people are, the idea of what's the inquiry that's going to have to happen when we're through the current crisis. And I related to this, she wouldn't have called herself a feminist, but that's my word. But she wrote and wrote and wrote, and one of the common themes, constant themes, is the role of women. She was very critical of the education available to most women, the limited expectations they had. This wonderful quote, "The time has come when women must do something more than domestic hearth," which means nursing the infants, keeping in pretty cows, having a good dinner, and an entertaining party. You know, I put that picture up again because I think that would have been the life that her family wanted for her. She was having none of it. And then the final quote I've picked out, "Why have women passion, intellect, moral activity, these three, in a place in society where no one of the three can be exercised?" Her frustration just jumps out. Though it didn't stop her, but I think she could see that for many women, they didn't have those options. And she was passionate about education. Which again, I think comes from her own education, from having seen the Ragged School. But when there were some problems with British soldiers, education was her answer to it. Army doctors, she thought they needed educating, and she was probably right. She set up the Nightingale School of Nursing at St Thomas's, and having, I think, not been heavily involved in the fundraising, my goodness, she had clear ideas about the actual school, detailed instructions. It was to be taught by practitioners, not by theoreticians. She had some wonderful things that each of the nurses or students should have their own room that they could work in. And what happened was that as those graduates then took senior roles and went worldwide, her influence spread. So really fascinating. And if you want more about her education, which I'm drawing heavily, article by Alex Atwell brings out a lot of this. And she was interested in all sorts of other education, the village elementary school near her family home in Derbyshire, schools in British colonies, education in workhouses for the poor. She addressed the issues wherever she thought. But the common themes that keep coming out is that she thought that practical education should be hands-on, manual skills, so that the people of the schools in this case should come out ready and able to work. And she also had a long-standing interest in India, and in the context of sanitary reform and promotion of sanitary education, which went painfully slowly, she had this wonderful quote, "I never lose an opportunity of urging a practical beginning, however small, for it's wonderful how often in such matters the mustard seed germinates and roots itself." And I found that a really inspiring idea, that sometimes, I don't know about you, but at the moment, sometimes life can be absolutely overwhelming, and you just get started. You know, you write perhaps the plan of the paper that you've been putting off, or you just start thinking about how you're going to organize yourself in this new life. But, you know, just a small start, and then somehow it just grows. And she also, despite having not been to university herself, which is a story I won't go into, but she wanted to introduce statistics into studies at the University of Oxford by setting up a professorship of applied statistics. And she thought that this should address the need of statistics relating to education, peonology, workhouses in India. She thought that the point of education is to teach men not to know but to do. That's not her quote, but it's one she quoted regularly. Her thinkings about the training were again very practical, and in reading them, I'm reflecting just how much this should be applying to the training of statisticians, that we need to know the theory, but we also need to know what to do hands-on and how to think about it. It's not just the mechanics of it, it's how to think. And this every 5 or 10 years really requires a second training nowadays. Never could that be truer. And much of what I've talked about isn't statistical. It's much more general, but I'm just passionate about statistics. Statistics is the most important science in the whole world, for upon it depends the practical application of every other science and of every art. The one science essential to all political and social administration, all education, all organisation based on experience, for it only gives us a result of our experience. She thought that statistics was absolutely central, but remember, she's coming at it from this incredibly applied, wanting to know what it can do perspective. And why did she want to set up a chair at Oxford? Again, I'll read this, it's a long quote, but I just think it's fabulous. She was writing to Benjamin Jowett, and she was taking a pop at politicians. Remember, her grandfather was one for 40 years, so she knew quite a lot of the inside of it. And she said our chief point was that the enormous amount of statistics at this moment available at their disposal, or in their pigeonholes, which means not at their disposal, is almost absolutely useless. Why? Because cabinet ministers, their subordinates, the large majority of whom received a university education, have received no education whatever on the point of which all legislation, all administration must ultimately be based if you want to be progressive. We don't want arithmetic and theory. We want to know what we're doing in things that must be tested by results. And I just think this is such a fabulous image of pigeonholes full of stuff that could be useful if only people knew how to use it. And again, I would love to think what she would make of some of our regular briefings from our cabinet officers, cabinet ministers at the moment, talking about statistics, some of them rather less well than others. So what's our modern equivalent? We don't really have pigeonholes like that anymore. Even when I do have a pigeonhole, it's actually pretty empty these days. But I don't know about you, I feel like that sometimes. Phone calls not returned, different email full of stuff that would be useful and I should be making use of if only I took the time to go through it and systematize it. So we've still got this feeling of being overwhelmed. Now, coming much more to the sort of current time and what is the RSS doing about some of this stuff? Well, we have picked up that challenge with the RSS Data Manifesto, which was published in 2014 and has gone through 3 iterations now. And we sent it out to candidates for election to get them to pledge that if they are elected, they will take up training. And many of them sign it. Slightly fewer of them actually take up the training when they're elected, but some do. And it's little pocket size, so they can keep it, but it's got 10 recommendations to the UK government about how it can improve data for policy making, for democracy, and for society as a whole. And I think the quote I've highlighted is just one of those. But this really reflects what Florence was talking about. The politicians and others should be given basic training in data handling, statistics, and interpreting that evidence. In other words, it's not just something that they have their teams doing, they need to understand it. She wanted to increase statistical capacity, and again, that's more relevant than ever. We need a greater depth of training. We need a step change in the quantity of people trained. Royal Society put out a report on data science skills in 2019, and I was delighted to see that my predecessor, Adrian Smith, is the incoming president of the Royal Society, so I can't imagine the emphasis on data science is going to get any less under his leadership. We need to understand machine learning and AI. But equally, people doing machine learning and AI need to understand us. And interesting, this is a slide I showed last year. I said important role for online teaching right through to, from the sort of little modules right through to full degrees. And we've started to do that Imperial. My goodness, the whole world has gone in that direction now. This morning, they announced no face-to-face lectures next year. They'll try and do face-to-face teaching. So this was enormously prescient, though, for very sad reasons. But certainly for building statistical capacity, it often lends itself to an online delivery. Now, building statistical capacity. ask yourself who these happy chaps are. Now, if I was face to face with you, I'd be able to see you guessing. They are, I think, the complete set of presidents of the Royal Society who have the first name David. So we've got David Spiegelhalter, my predecessor, David Hand, David Bartholomew, up on the right-hand corner, David Cox. We've got David Finney. You might wonder what this picture is. That's because the first David I could find was called David Heron, and I couldn't find a picture of him. So this is from my walks in St James's Park about a month ago when it was still pretty deserted, and the heron there is really kind of taking ownership. So that stands surrogate for David Heron rather than having missing data. Why have I shown that? Well, they've got a couple of things in common other than being called David and being presidents of the RSS. And if I do my little histogram of presidents by first name, on the left is all the Davids, on the right is not all of the Denises or all of the Valeries. This is all of the female presidents of the Royal Society. So we've got one more to go before we even equal the number of Davids. And the reason I'm showing this is that diversity is one of the really important ways of building capacity. There's much more to diversity than gender. For a start, all the skin colours look pretty similar, but that's an important way of building and enlarging what we're able to do. Last year, when we were still doing face-to-face things, I was delighted to speak at an event put together by the Young Statisticians and various other sections celebrating women in statistics. And it was a really great event. And it just says how many great people there are out there that now are we're drawing on, whereas in Florence Nightingale's day, all of those would have been at home either kind of scrubbing the steps or doing their embroidery, depending on which social class they came from. So it's very exciting. And just to show an international focus, in the middle is my colleague and friend Jane Hutton out in Africa at AIMS, the African Institute for Mathematical Sciences. It's not only women, but that is just such a joyful photo. That's the one I like showing. And there's lots of other investment going on as this capacity. Perhaps I might highlight that the RSS had an initiative called Statisticians for Society, which is where volunteers give their time to help out some of the smaller charities. And we've just got a very major grant from the Lottery Foundation in order to continue that work at a rather greater scale. And that's not training people to be statisticians necessarily, but it is spreading statistical literacy. We're not the only one to think this. There's been a discussion at high levels about the need for high-level statistical expertise, including the ability to work in highly multidisciplinary scientific and legal frameworks. And John Kingman, this is John Kingman the Younger, who is the chairman of UKRI, talked about the skills required having to come to another level, both in terms of depth and the number of people needed. But if we can rise that challenge, the potential for using data for the public good is absolutely enormous. And I think this is what Florence could see. And in her way, she tried to change things. And I think we're carrying that on, but perhaps at a rather greater scale. But then the need is much larger. So I'm optimistic that mustard seeds can grow. So where are we now? Because this is more or less where I finished my presidential address last year, looking to the future, but life has taken some unexpected turns. So there are more opportunities than ever for statisticians, and this is just a small snippet of what some of the statisticians are doing. This has been the source of huge debate, and I'm sure will carry on being huge debate. This is from some of my colleagues at Imperial. Neil Ferguson's the first author of this one, Crystal Donnelly, who's on council of the RSS and next year's going to be the Vice President for External Affairs, is heavily involved in this work. This was this was report 9. I think there are now 20-something reports, and they put them up as soon as they've done them. But this was on the impact of non-pharmaceutical interventions to reduce COVID mortality and healthcare demand. You'll notice, so it's under various models of what if we do nothing, we get a massive peak. What if we do case isolation, household quarantine, general social distancing? What if schools and universities close? And the red line here, which is magnified here, is the bed capacity. And the issue that was stark there, and I remember when I first heard these results a short while before, the issue, or an earlier version of them, I should say, what was stark was that if nothing was done, the NHS critical care capacity would have been absolutely overwhelmed, which would have been a dreadful scenario. And as part of that, and I think Florence Nightingale would have been proud, that allowed planning. The data allowed us to think, first of all, what actions we took. And certainly 16th of March was the day that I realised I was someone who should be staying at home. That was the day when they said some people should be staying at home, and a week later they basically said everybody should. But it also allowed us to plan for surge capacity. And this is the opening of the Excel Centre in London, named after Florence Nightingale. I'm sure they were highlighting on her nursing activities, but I rather think it's the planning. Now, fortunately, that hasn't been much used, and it's now been stood down, at least for now. And that's absolutely fine. You've got one up near you in Harrogate. I was meant to be staying up this weekend to go to my friend's son is in barbershop quartet. I was meant to be going to that with her, but that, I gather, well, the convention has been stopped anyway, but I think that's also been commandeered as another Nightingale hospital. But I think Florence Nightingale would approve of this because it's action. It is International Clinical Trial Day today, and although Florence Nightingale didn't participate in clinical trials, I mean, I think she'd have liked the idea, it was just she was sort of rather before their time, but this is an evidence network of COVID-19 clinical trials, the top 15 interventions, and each of these connections is the number of trials going on. So chloroquine, which we've heard rather a lot about, is being tested against all sorts of things. And lots of statisticians are playing key roles here. I'm on the data monitoring committee for a trial being run out of primary care in Oxford, which was got up and going in almost no time flat. It's an adaptive design. There's adaptive designs going on elsewhere. So statisticians' preparedness have allowed a lot of these to get going. And this is phenomenal for a disease that we didn't even know about until the very tail end of 2019, the last few days. To actually have these trials up and running, I think is incredibly impressive. Lots of people asked me what the RSS was going to do about it. My initial reaction was leave the people who were doing the stuff to get on with it, but actually it became clear that there were some wider questions. And so we've asked Sylvia Richardson, who will be taking over as president next year, and David Spiegelhalter, my predecessor, are co-chairing a task force. And I was very keen, at the time the debate was just running, but I was very keen that it was actually much broader than that. So it's about design and data collection, diagnostic studies. We've got John Deeks on because it was quite obvious that there were going to be statistical issues there. Forecasting, treatment studies, what we didn't envisage, but actually one of our fellows sent in a query about the forecasting of the A-levels, and that we put through the task force, and they've now, they drew also on, I think, Guy Nathan and one or two others who've put in stuff on TEF before. They've put in comments on the statistical issues there. So anything to do with COVID, they're either advising or at least acting as the focal point. So that is really exciting. And again, we move very fast on that. So what was Florence Nightingale's legacy? This was from her friend Benjamin Jowett, who was Master of Trinity College, but she wrote her this letter. There was a great deal of romantic feeling about you 23 years ago when you returned home from the Crimea. And the context here is that she got some kind of illness in the Crimea and no one's quite sure why. So basically, after she came back, within quite a short while, she'd taken, I think people thought she was going to die. And she didn't, but she worked from her room. So he said, you now work on in silence. Nobody knows how many lives are saved by your nurse in hospital, how many thousand soldiers are now alive owing to your forethought and diligence. How many natives of India in this generation, generations to come, have been preserved from famine and oppression and the load of debt by the energy of a sick lady who could scarcely rise from her bed. The world does not know all this or think about it, but I know it and think about it often. And in many ways, I think that is an incredibly nice testament to her. It could, I'm sure he thought it would stand as her epitaph. I was just taken by the energy of a sick lady who can scarcely rise from bed. And I was picturing a really old lady. And then I did one or two sums and realised at this point in 1879, she's actually younger than I am at the moment. I mean, she might have been ill, but she was hardly, it wasn't that she couldn't operate. And I'm glad to say that she didn't just keel over and die saying, well, Benjamin Jowett says some nice things about it. That was 1879. This picture is taken in 1906, so some 27 years later. And she still hadn't moved very much from that room, but my goodness, she was still active. And I just thought, she's got it sussed. I have no idea where some of you are watching this webinar from. I mean, I hope if you've got somewhere outside that you can watch it from, that you've managed to do that. But I thought, this is a lady with style. Yeah, just because she was confined to her room in her own personal lockdown didn't mean that she stopped operating. And I find that incredibly encouraging. You know, she communicated with all sorts of people, and she didn't say, well, I'm just a woman, or I'm stuck in my room, I can't do it. We've got her books by her bed. I'm sure she must have had somebody looking after her. I'm sure she wasn't making her own bed and her own cups of tea. And the flowers, so fabulous. So when I'm thinking, oh gosh, you know, I'm stuck and not seeing anyone, I'm remembering Florence. So what would she make of this? I don't know how well this is transmitting, but this is actually the House of Parliament last week. I didn't go along and see it, though I actually live quite close. I hadn't realised they were doing it, so I've stolen this picture. But they projected onto it, and that's the whole length of the Parliament buildings just about, this lights to celebrate her 100th anniversary. Got, again, some of you can see it clearly, some can't. We've got either Florence Nightingale or someone from that era on the left-hand side, and a modern nurse on the right-hand side. And those of you who know that part of London will know that this would be taken from St Thomas's Hospital, which is absolutely opposite the House of Commons, which is where the Nightingale School of Nursing is. So that, I think, is a fabulous testament to her nursing, and that's how it's intended. I also just love the idea of Florence Nightingale having that much power over the House of Commons. I think she would really have enjoyed that thought, and shame we can't leave those there all the time as a reminder of them needing to be much more statistically literate. But what I'd really like to say is that Florence Nightingale did a huge amount of work. Benjamin Jowett's legacy stands, despite me carping slightly at the tone of it. I think she and some of her contemporaries changed the way we do statistics. And so I'm going to stop at this point to say happy 200th birthday to Florence. So thank you very much.
Thanks very much, Deborah. That's fascinating talk. That's thanks very much for the talk. As I said at the beginning, that there's an opportunity for people to write questions in the chat bar on the right hand side, and I think just to get started off, I just wanted to ask whether you had any sort of reflections on. Sorry, this is quite a complicated question. That my as working as a statistician in a government department, that generally I quite often feel I'm working on in silence. And the last few weeks have been quite refreshing in a way, because we've seen politicians saying that they're basing everything on the evidence. We've actually seen politicians standing in a room talking about graphs and charts and explaining the data to the public rather than just talking in sound bites. I wondered if you had any reflections on whether this sort of dawn of a new era, or whether this might be a fleeting moment when statisticians have their say.
Yes, we're allowed to have our boxes for once in 100 years. I mean, I've got lots of thoughts. I think the first one, I want to be positive, because I think that the whole way it's been handled, the whole science that's been done, when you think what we understand about a disease that we hadn't even heard of 5 months ago, is absolutely phenomenal. And it's not just about statistics, there's virologists and all sorts of others, but statistics is absolutely part of that. And the very idea that there are daily briefings where we're looking at the statistics is absolutely phenomenal. I also think that journalists, by and large, have really dealt with a complex story very well. I mean, there's lots of things that I'm not happy about, but broadly speaking, a lot of the media have grappled, interacted with scientists, the Science Media Centre playing an absolute blinder of sort of all the time matching questions with appropriate scientists. And so I think we should celebrate that. And I find it hard to believe that we will suddenly go back to some completely old way of doing anything. Nevertheless, what it now means is that those statistics and the modelling are at the source of a huge amount of debate, some of it very legitimate, some of it really rather nasty. And if we put our heads above the parapet, then we've got to expect that. And I think one of the things we need to do as statisticians is to learn from this, learn to deal with it, but also then to think, well, how do we do things better? Because clearly, one of the reasons that the journalism work well, or is working well, I think, is that there's been a lot of work with journalists from the Royal Statistical Society, with the Science Media Centre, so that journalists were prepared and knew that they needed to ask questions and have come through, and I think that's played well. On the other hand, we've got other people, I mean, including some politicians, who aren't, find data difficult, others are great. And we've now got this really interesting debate between what's the role of science, what's the role of politicians. And so although it's obviously, because it's so serious, getting really quite ratcheted up, I think that's absolutely fascinating. So I don't think, I think life has changed for good. Exactly how it will pan out, I don't suppose we can have daily statistics briefings for the next 5 years on all sorts of topics. So, but I think that's, we've all got a role to play in that.
Yeah, I suppose it has sort of implications that, so that to some extent the sort of journalists and politicians have stepped up by taking numbers seriously, but also the communication of the numbers from the professionals has been has worked well, I think.
Yeah, I mean, that's a work in progress, and there are some things I know that some members of the RSS Task Force are frustrated because this is not, I mean, it might be by far the most serious pandemic we've had, but it's not the first one. And some of the lessons about how to present data, whether it's by date that swabs were taken or dates that they were done, are ones that were well learned in previous pandemics. And some of the inconsistencies reported between countries, there's no great, there are things that we could have done an awful lot better. So there are lessons that we didn't learn, and I think they're quite right to be criticised. I think broadly speaking, it's there's a lot of good, and it wouldn't want to chuck the baby out with bathwater.
Yeah, thank you. So I'm just going to pick up a couple of questions that are coming on the chat bar. So Tim Davis has asked, well, it seems to me that Florence Nightingale was a good problem solver, and could well have been an engineer and been carrying one of those cards, I suppose. Do we have enough problem solvers in the public health space today? Is the question.
Yeah, no, I agree that she could well have gone into engineering, and I think she might well have been sort of attracted to it because of the problem solving. Had she lived in a slightly different generation, I mean, indeed, had her grandfather been an engineer rather than an MP, for example. Do we have enough problem solvers? Well, there are days I think we've got too many, because I'm on so many discussion things about how to do things. Actually, we need all of that. We need the local public health people. We need the modelers. We need the people thinking about trials. I think there are some structure. Yeah, I'm sure this will come out because there will be an inquiry afterwards, because there has to be. But some of it is about where the responsibility lays, and so the modelers do that, discuss with politicians. But then the testing and tracing is an absolute nightmare, and that's partly, I think, due to fragmentation of public health at the moment. So I think it's not quite the problem solvers, but it's the infrastructure, and maybe the people who should have been thinking about how would we handle this should have been there earlier. But yeah. So I think there's enough. I'm just not sure they've got their act together in quite the most constructive way.
Absolutely. So I'm just going to run through the questions. So Eleanor Franchu has asked, did Florence's gender back then present barriers?
Yes, I think it did. I mean, I quoted a few quotes about her wanting to do education. She was very constrained as to what she could do. I mean, I think she also, like many women who are successful, she then had made it work for her, because I think people didn't forget her. But she was very lucky to break through, and I think she could sense that other people didn't. But I mean, it might be in the end we benefited, because if she'd been able to do some of the first things she wanted to do, she might have gone into a more ordinary nursing career. Whereas actually the experiences she got when she was frustrated by that and had to do something else, I think stood her in good stead. But no, she had to fight, and probably, I mean, lots of people are still fighting, but I think it was far worse at that time.
And I think we're getting to some specific questions about COVID-19. I think so.
Yes.
I'm going to read this one out. So given the lack of initial testing for COVID-19, so this is not attributable to the person reading it out. It seems to have reverted back to old war times with poor data collection needing improvement. How do you think this has impacted our ability to analyse this during and post COVID-19?
It hasn't. I mean, I think you're absolutely right, Laura. I think it hasn't helped. And I think the confusion around presentations of data, people either not being clear what they're presenting or interpreting different ways, has made the debate more messy. And it's not just the ability to analyse it, it's the ability to act on it. But we have got data, it is complex data, but again, we could have done better. And you think, well, if Florence Nightingale was to do those coxcomb diagrams in her era, other people could do good things. But on the other hand, people like David Spiegelhalter are doing a lot of really good work about how you present data. I know that he's advising some people in government as well as people outside it. So I think there's both really good examples and then the worst. And some of the frustration has been about what data is in the public domain. So I think sometimes some people had access to it, other people want access to it. Really early on, I saw all sorts of things of, can we have the data? I thought, no, you can't, because that data has not been collected yet. Nobody at that time was doing population serology to find out what the prevalence was, because the testing still wasn't there. So I think there was some naivety about even what data might be available. But even when it was, it's taken a little bit of time to be shared in the right way. But on the other hand, we've been dealing in emergency situations. Suddenly everything's in real time. So I've got a lot of sympathy with one of the scientists on SAGE was asked about the secrecy, and she said, to be honest, our job to give best scientific advice, I was so busy doing that, I just didn't think about whether it might look as if it was secretive or not. In other words, it wasn't her first concern. I mean, arguably it is an important concern, but I think she was just saying we were so much in the thrust of it, we were just trying to think through what was the right thing to do. So that's a sort of an answer on that.
Yeah, it's sort of, well, it sort of gets about sort of tension, doesn't it? Sorry, that sort of tension between whether we're collecting the right data in the first place is one set of issues, and then whether having collected the data, we've then got an appropriate process to put that in the public domain in a fair and equitable way, I think is the official GSS terminology.
Yes, and what makes it particularly complicated is the real-time nature of it. There's an awful lot of things that if you've got the luxury of a bit of time, you can do, whereas the counts in real time, when some of them haven't come in, it's a bit like those of us working clinical trials on data monitoring committees. You've got to look at things in real time, and you know that for the final analysis, you can tidy things up and classify things properly. But I think that's part of the challenge of what can you reasonably do, kind of, as the data is coming in, because obviously people want to know what's happening today, not a nice tidy picture of what happened 3 weeks ago.
Well, yeah, absolutely. So just go back to the question. So Andy Sutherland has asked whether you think the RSS Task Force has had as much impact as it could, and I think there's a sort of juxtaposition there of influencing the decisions as they've been made, rather than
certainly. I mean, there may be areas they could do more, but certainly in some cases it's real time. So we're doing, and I should say conflict of interest, at Imperial we're doing one of the big prevalence studies, and we were asked to, I think, on the Wednesday evening, and we had it to ethics the following Tuesday morning. We wanted our protocol critiqued, so we sent that to the RSS Task Force and got back superb comments quickly that really actively helped improve it before I went to ethics, because there was no question of it going for peer review in that time frame. And I think there are other instances people have come to ask for me for help with, in one case, somebody in a government position. I put them onto the task force, and somebody immediately stepped in and said, yes, we're doing something, I can help you on that. So there's certainly, it's been the kind of go-to place for people who have contacted the RSS. Of course, there'll be some things where they could have, they haven't been asked, but I think at least because they're there, there's a sort of point that if people do seek help, or we think they need it, we know who to put them in contact with. So there's a network element to it, but this isn't the post-mortem group. I'm sure there'll be another one of those, but this is the group who are trying to do what they can do in real time.
Yeah, I just a brief personal reflection on that. Actually, for civil servants in general, we're trying to be sort of politically impartial, and that sometimes introduce constraints in taking part in Royal Society groups or external groups, but particularly on something that's so high profile. And well, yeah, I don't know if there's sort of lessons there for us in how statisticians working in government can work more effectively with the wider RSS.
No, that would be interesting. Yeah, and I think we should look at that, because this was put together, sort of fairly quickly with a, and just thinking, what might have been a better way of doing it, but just thought it was far better to do something and get on with it rather than spend a lot of time on the process of it. But and I think some of these conversations going behind the scenes, how many of those will be public? I mean, I'm sure that the task force will talk about it when it's appropriate. But I hope they're being seen as constructively helpful rather than otherwise.
Yeah, absolutely. So one more question on the chat bar from Miles Gould. How concerned are you that politicians are hiding behind the science or the scientists when making policy or justifying decisions? And what would Florence think? Given what you said about building their capacity.
I think it's absolutely fascinating ding dong, because clearly politicians have got their lines, and one of them is we are following the science. And any scientist will say we're presenting options, but in the end the politicians have to take ownership, and it is a difficult balance. And I'm sure some, am I concerned there? I mean, I'm concerned about some of what's going. I mean, I'm not concerned in general that there's an interesting tension between what scientists are saying, what politicians are saying. I think that's inevitable. I am concerned about some of the nastiness that's going on, some of the reporting. There are layers that I won't go into at the moment, but if you read the press or Twitter, you can see there are layers of, in some cases, real nastiness. I mean, not necessarily coming from politicians, coming from other people trying to influence debate. And that does concern me a lot. And the reason it concerns me, and the reason I'm raising it here, is that we've spent a lot of time as the RSS getting statisticians to stand up, to be public, to engage. And if what they then get is sort of vilification, personal attacks, then some will step back. And I think that is deeply worrying. Any debate about the science and the role of science and policy is fine, but when it starts getting personal, that is distressing, because it's not something that particularly statisticians are used to having to deal with. What would Florence say? I mean, I think she'd say, politicians ought to understand the data a great deal more and take responsibility. And I think I'm sure she'd be saying to the scientists and the statisticians, stay in there, make sure that they know, and you tell them how it is. I mean, I don't think she'd say to either lot, well, just play nicely. She'd be telling both to grow up.
Yeah, thumbs up there from a correspondent. So I think there's a statement there rather than a question. Scientists have to champion reality over perception, and politicians do the opposite.
Yeah, and I mean, politicians they do have to give people hope, and whereas the job of the scientist is to tell it as it is. I mean, I thought Ian Diamond was brilliant when he was on the television briefing, and he used the kind of phraseology only he can do, which is, well, so-and-so said this, and I couldn't possibly demur from that. But more generally, I mean, apart from anything else, there is going to be an inquiry. All of this is on the record. And so they would be pretty daft for their reputation going forward if they didn't champion reality over perception. I think that's what motivates most scientists. So I absolutely agree with Tim on that bit. And politicians do what politicians do, and I'm not a politician, so I couldn't possibly comment. But I couldn't demur either.
I just had one more question. I don't know whether this is controversial topic or not, but it's been noted in some of the coverage that the countries with very low rates of infection and very low rates of death from COVID also happen to be the countries that've got female presidents and female prime ministers.
Yes, and yeah, I would love to interpret that and to say that, well, that means that every country should have a female prime minister, but you also have to, of course, look at the confounding of what is it about countries that make them wisely choose a good woman. Yeah, I mean, I think in New Zealand, Jacinda is absolutely brilliant. Even her tactful way of explaining about the Easter Bunny and the Tooth Fairy, that they were subject to lockdown as well, so that the children must understand if they couldn't deliver things. I mean, she just said it so, she explained it so well. But yeah, I mean, I think we're going to carry on doing inter-country comparisons for a long time. But yeah, I am enjoying the female leadership, but I wouldn't want to get too causal about it, although I wouldn't rule out some causality either. But they are wise. They are wise people, and that's what actually counts.
Absolutely. So another question is just in what's your opinion of the infection rates are, and do you think it's accurate enough for the government to be basing restrictions on or off?
Right. Well, I mean, my first reaction is one of complete amusement, because I'm not an infectious disease modeller, but I know what R is. I remember taking my daughter to a university open day, and somebody giving a really nice talk on that and just how volatile it is, especially when it's round one. We teach our students, to me that's something that is taught in infectious disease modelling courses, but isn't part of real life. And then suddenly every armchair epidemiologist knows about it. I mean, I think the question is what you mean by accurate enough, because people are saying what's it in this area, what's in that area, and I think it is hard to know. But on the other hand, it is absolutely the key parameter. And I think as we get more testing data, as that scales up, both the serology, which is have you got it at the moment, and the antibody, which is have you had it, and we get better handle on the data, then it'll be accurate. But I don't know what else we could be basing on. Obviously, the absolute prevalence is important as well. Yeah, so I think the infection rate is a key parameter. I wish we'd had more testing in place a lot sooner to have a better understanding of it and how it's changing. But for example, if that starts going up, as there's a huge debate about whether we've lifted lockdown too early. If the R starts going up, then it would certainly be the right basis for restricting it again if we need to. I mean, I very much hope, obviously, that it doesn't, but it's we've got to monitor it.
Oh yeah, absolutely. I think that's. I think we can all agree with that, and it'd be best to be able to measure it more accurately. But we have what we have.
And it's accurate enough. Well, it may or may not be, but that's what we've got at the moment. There isn't some other magic solution for basing data on. We can learn from other countries, but just copying what some other country has done doesn't work terribly well either, because they've all got their own contexts. So yeah, the R feeds into it. It's not the only parameter, but it's a key parameter.
Thank you. I just wonder if there's any more questions from the audience, the virtual audience. Otherwise, I think it's a really excellent talk, Deborah. So thank you very much for that. And I think a very wide-ranging discussion afterwards as well, which